This COVID pandemic is not just a virus of its own. It's actually a combination of infrastructural and demographical factors that make it possible. We pretty much created a hospital environment for this virus, and that's how something not particularly deadly as coronavirus actually causes this horrible pandemic. And if you think about it, coronaviruses have been around since forever, and they have been causing common cold. So it mutated. It is more deadly than it used to be, but still, for most people, it is actually rather benign prognosis. So mean that gonna recover without any treatment whatsoever. But there is a risk group, and those people are actually the one who we're trying to save. And there are some risk factors or factors of transmission that allow this risk group to stay at risk. So how did these things happen? And we have to understand how to target them, because if we fail to change something, we will have a vicious cycle of going from one strain to another, from one pandemic to another, because we have the risk group and we have the means for this pandemic to thrive and go on. And this is like, let's say, opening a sushi bar, because you now have very good food, but that food is very perishable. So now you have to create very good conditions for this food to be preserved so it is safe. And same thing here. Simply because we created this risk group means that we have to make a much safer environment for them, and so they don't die and pandemic is not being formed. And if we think of what factors are the ones that contribute to that, well, first of all, what contributes to formation of risk group, and this is advancements in our civilization for past decades. Many advancements in medical fields, such as new treatments. Let's say somebody would be diagnosed with rapidly progressive cancer 20 years ago. That person might have been given half a year or a year and then unfortunately die. But now, because we have monoclonal antibodies, we have multiple novel treatments, we can extend his life for 5, 10, and maybe more years, but unfortunately we cannot cure the cancer itself. So this person stays in a risk group, so he can live longer, but he is chronically ill, and thus the risk group is formed. And it is also formed from multiple other diseases that have undergone same modification, that we can control them but not cure them, such as hypertension, diabetes, multiple autoimmune diseases, and many other diseases that we have learned how to control them, but unfortunately cannot cure them. And that forms the risk group. Also, this risk group has become much more socially active, and this is all of that is very good thing. So we have better means for transportation for these people. We have better means for them to socialize. We also created nursing homes so people can again live longer, even if they have some very bad diseases. But again, all of that has created a very big part of population that is a risk group, and this is how pandemic formed. Of course, we cannot remove the risk group. We don't want to refuse of those advancements that we made. So that means that we're gonna have to make our environment much more safe. And the other thing that changes is just a social relationship, just a social idea, because of how we have dropped the amount of people that die of medical causes prematurely. That means that each and every death is now being treated as a big disaster, whereas many years ago people wouldn't talk about just few deaths and just some factor that caused that. Now it is much more a socially touching subject. And again, this is not a bad thing. We just have to understand what we can do to make things safer. So which factors contribute to transmission, how we can abrupt the transmission of this virus. And the factors that contribute the most and are modifiable the most are ventilation, surface sanitization. We can make quarantine be targeted, as well as targeted testing, and improve safety for healthcare providers. And these all things are very important, because if you think of each one of them, so why do we have to close businesses? Why do we have to close schools and many other things? It's because we cannot gather indoors. Or why we cannot gather indoors? Because it's more dangerous. Why is it more dangerous? Because of ventilation system contributes to spread of the disease. So if you modify ventilation system, we can altogether eliminate this risk factor and make place safe, so everybody can gather indoor, no matter if anyone is actually sick or not. The other risk factor is surfaces. So we have some means that we try to sanitize surfaces with. They're actually very ineffective. We have to use much more effective things, such as UV light projectors. They can keep some surfaces sanitized 24/7 after each touch, and we have tools to do it, so we have to do it and make our environment more safe. We also have to use mobile phone apps that can allow us to be informed if we have been in contact with people that later turn out to be infected, and this is a problem of coronavirus, that it takes sometimes few days for symptoms to develop, or you may not develop symptoms at all but still be contagious. So now if you would be informed that you have been in contact with somebody who later turned out to be infected, now you can be informed to get quarantined and get tested, and that how we can disrupt this social transmission of virus altogether. And lastly, we have to think about healthcare providers, because many of them just refuse to work in unsafe environment, and that's completely understandable. At the same time, if we lose healthcare provider, no matter would it be because they're afraid to work in unsafe environment, or they just contract the disease and they get sick from it, we're gonna lose this pandemic. So what we have to do, we have to improve their safety, and personal protective equipment that is being used right now is very insufficient and has a lot of bad flaws that make life of healthcare providers very hard, and they contribute to forming other risks, such as simply put, one of many risks is just fogging of glasses because you have to wear a mask. That creates a risk of you tripping and or making other errors, such as using wrong medication and things like that. So this one particular issue is one of many issues that actually comes with usage of personal protective equipment. So we have to make a better choice of personal protective equipment, make a new type of personal protective equipment. So in my other videos, I talk a lot about how we can easily modify ventilation systems, how we can implement surface sanitization, how we can implement and what would be the better personal protective equipment, as well as what are the solutions to being notified in case of infectious disease contact. So all of these things are available, they exist. We simply need to put them into use, and I ask each one of you who is watching this video to share this information, share this video, like and subscribe, and help me make this place a little more safer. Please just don't disregard these factors, because we will be going in more issues as this pandemic progresses. We will have other pandemics if we don't make our environment safer, and this is the only way. So again, thank you very much for watching this video, and please share your thoughts, comment, and share this video. Thank you so much, and have a great day.